Yeah, good day. My name is Dr. Obinna Ebirim. Today, we're going to learn how to pitch a public health intervention. And the example we are giving today, I'm making a presentation on communicating the value of vaccine in a new way, training of national vaccine advocates in Nigeria. So, this kind of presentation we might want to deliver after identifying a gap, in this case, a need to train national vaccine advocates in Nigeria on communicating the value of vaccines in a new way. Probably during your research, you found out that the old ways in which they communicated is about the value or the importance of vaccines have not really been very effective. So, this is an example of how to pitch a public health intervention. So in the course of this presentation, I'm going to give a brief introduction, then talk about the initiative. I would examine the old way of communicating to be able to make a case for the evidence for the new way of communicating. And what then is the value of this new way of communicating? I will then talk about how does this then translate to increased vaccine uptake, because we know that now when there's increased vaccine uptake, that will lead to higher immunization coverage, more life saved, and people then saved from the burden of vaccine preventable diseases. With every public health intervention or initiative, there is need for a monitoring and evaluation. I would go through the monitoring and evaluation, then before we then conclude the next steps. There is also a reference list um, where we got the materials we used in developing this slide. So, in terms of introduction, we know that vaccines save lives, they protect against disability. Immunization is one of the greatest achievements of mankind, saving up to 2.5 million lives every year. But beyond that, we have seen educational, economic, behavioral, and social benefits of vaccines. Like children who are vaccinated are more likely to grow better, have more cognitive function, and then also it saves costs that would have used to treat vaccine preventable diseases. And these benefits, they are not just for children; it also extends to adulthood, in the sense that when people who are saved from some vaccine preventable diseases, they grow up to be better professionals. They can carry out their activities better, unlike one who is not vaccinated and they maybe fall ill with vaccine preventable disease like poliomyelitis and then lose ability to work and function properly. And then it also helps in terms of both the family and national economy, because then if less people are falling ill, it means that the resources spent by government in taking care of its human resource for health, buying drugs, and more like the health expenditure on its citizens would reduce, so which would also help the national economy. Um, so this broad-based benefit makes vaccine a tool for promoting health. And if you see what Ellis and Smith in 2017 notes that the new way of measuring the absence of disease is well-being influenced by diverse determinants. So if if vaccination then confers a lot of these benefits, just not just health, but then also economic, education, and social benefits, then we can say that vaccines are a good tool for promoting health. And we're not talking about health as just the absence of disease and infirmities, but also that which extends to other social determinants of health. So, in terms of beyond communicating vaccine and the importance of vaccine, some other ways that the WHO has recommended that one can extend the benefit of vaccines to all people is that countries should raise their immunization coverage to 90% at the national level and 80% at the subnational or district level. But in Nigeria, we have with I think as at 2017, when this study was developed, it was around below 50%, but now a little above 50%. More than or about half of eligible Nigerian children are not getting the vaccines they need. So, and what has happened is that, among other factors that have led to this, is that previously communication did not really translate to expected change in terms of increased uptake and nation coverage. So, so what we are proposing in this initiative is to train Nigerian vaccine advocates to consider a broader scope in communicating and message framing that that considered other determinants of health, and not just saying, "Oh, vaccines prevents disease and prevents death." How else can you communicate about the importance of vaccines so that it resonates well with people in local communities? So, in terms of description of this initiative or intervention, um, first of all, the focus will be on individuals. So, these national level advocates who we expect to will raise the awareness among them and expect them to then um, carry these messages to fellow advocates, and then also maybe spread this new way of communicating about the value of vaccines. Um, the strategy that will be used, it's more of an educational strategy. So we intend to train them, and then not just to train them on the clinical importance of vaccines, but the broader socio-ecological factors. And the impact, we expect that the impact would come through a behavioral change. So what we call like behavioral adaptation, where people then change from communicating the old biomedical manner to a new socio-ecological way of the importance of vaccines. Um, Finally, the outcomes that are desired when we implement this initiative is that there are better health and quality of life, and we can measure that by the increased vaccine coverage and reduced under 5 mortality. So you can see the various evidence that suggests that supports this initiative. So Edgar et al. In 1990 stated that health promotion process model was adapted in designing the training conceptual model. So there is an evidence that this model we're using, which was adapted from Edgar et al. 1990 model, would work. And then we have Ghostin, McDonald, and Gurus in 2015 arguing that communication can be an effective tool in making significant differences to the behavior of individuals and populations on acceptance of vaccines. So that's an evidence that supports that if we communicate right, that would get more people to accept vaccination. But in contrast, Wishball et al. In 2010 suggests that only a 12 to 20% increase in vaccination coverage can be achieved when communication is included as a tool or a part of immunization strengthening. So this is just to say that there are those who are in support of communication being an effective tool, but as you see, Wellsbord is arguing that the increase might be minimal, 12 to 20%, but wherever it's still an increase. So there is a need for this initiative, and then there is it's something that is worth implementing. So let's look at the old way of communicating. So if you look at how Nigeria plans to communicate, so it's through development and dissemination of targeted images around immunization using flyers, banners, billboards, jingles, and during media engagements. This can work, but are there other ways we can do better? That's what we would identify after examining this old way. Then we can see what are the newer ways we can profile. Oku et al. 2016 argued that most of these communication strategies were to inform, educate, remind, recall, with limited intervention aimed at enhancing community ownership. So that's one gap that was identified, that yes, these communications work, but then it does not enhance community ownership. And there's a lot you can achieve when the community then owns this process, the vaccination process, and see it as something that It's an integral part of them. So that's a gap in this old way of communicating. Content of messages dwelled more on clinical value. I've mentioned that before. So we want to move from the biomedical model to more of a socioecological model. And what Ailes and Simnet 2017 suggests that this biomedical model does not consider a broader determinants of health in depth. So, for example, you see, when we're introducing, we didn't just say that vaccines they only prevent diseases. We talk about the educational importance, growth, economy. This is what resonates more with people of diverse background, and then that is what this initiative is trying to do, to communicate more on a socio-ecological level rather than the biomedical level. Often, mothers fail to comprehend these messages, um, and then sometimes it doesn't even resonate with them because the tool for communication is not that which resonates with the community. That's what Ogundimi in 1994 found out. So, really, in summary, yes, these are effective ways of communicating, but there are still gaps in terms of community ownership, in terms of the way it's framed, in terms of the messaging, to go beyond the biomedical model to more of a sociological model, and then carry it out in a manner that resonates better with the community. So basically, what's this new way we want to communicate, and what's the evidence around it? So we're going to use the dark green and white tail rainbow model that shows the various determinants of health and health decisions. So people are going to make decisions not just based on the clinical state, like, oh, it's going to prevent this and keep them alive, but also when you talk about the social setting, the lifestyle messaging, educational messaging, work related. So for example, so if you talk about like things like social settings, say engaging more than vaccine during social events can improve uptake of immunization. So when you consider that in your messaging and your advocacy, you would find out that you reach more mothers rather than the other ways that do not consider social settings. Maybe you just always want to tell them when they come to the hospital. Then the question is how many of them eventually get to the health facility. But if you then consider a social setting, that it's something that is a determinant of their health and their health seeking behavior, you then or their health behavior really, you then realize that you communicate better and get more value. Then also another thing is also to consider their lifestyle, because their lifestyle is also an important determinant. Then you also frame it considering the education of the child. So for example, if you then if you tell people that vaccination can improve educational attainment in children, and there's evidence around all this, it's not about lack of evidence, but it's just about intentionally framing it and passing that message with the consideration of other psychological factors that affect their health, and not just those clinical biomedical factors. So, we are going to use this dark green and white head model to identify factors that will be used during training, such that in both in message framing and delivery, that is one new thing we're bringing to this new means of communication. And these factors are the various influences on individual communities that have an impact on their health. The use of social media, in addition to audiovisual and print media, will be promoted in the course of the training. As we know, social media is growing, and we need to also consider that means of communication. We have evidence that social media platforms like Twitter can affect decision making for vaccines, and there is also evidence that suggests that internet can be a source of information and help parents in taking a decision on vaccine uptake. So, in addition to using this the green model in the messaging and the delivery, we're also going to make sure that we consider the use of social media in addition to the traditional means of communication. And one of the things you see in the green model, it's also things like culture, community, like community networks, right? So while doing this new way of this training, we're going to ensure that we train that the local context is very, very important. That local context is very, very important, because if you understand the local context, social setting, then you're going to engage people more. So while this new way of communicating, we are going to advance the use of local music and um, and maybe traditional town criers, so that we are communicating in a way that resonates, that the people in the local communities can understand and can reach our target. So basically, how would this then translate to increased vaccine uptake when you communicate in the new way and leave this old way? Or in addition, basically you're not leaving, but you're adding to that old way to make it better. So it first of all, using the Betty's model, the 1991 Betty's model, we find out that people are more empowered, right? People are more empowered when you use the negotiated bottom-up approach rather than the authoritative top-down approach. And that is what we are going to adopt, right? So you are going to empower people in a manner that makes them act, right? By rating, we are not going to use like health persuasion. We're not going to leave legislative action here, right? We are going to use more of personal counseling. That's talking to them, sensitizing in language that they understand, in a manner they understand, trying to use various means, and then talking about things that matter to them, and not just about health, things about the economy, education, growth, and about their children development. And then we would also, as mentioned earlier, would engage the community. So there will be a community development approach. So believe that this negotiated bottom up would then lead to empowering the members of the population, empowering these advocates to communicate, and also members of communication of the communities to uptake vaccine. And then this, we believe that when we do this, people will then make that decision to vaccinate their children because of this more effective way of communication. And then this will then lead, obviously, when more people take up vaccines, we need to increase immunization coverage, and then children will be protected from vaccine preventable diseases and death, associated death. So this initiative will also be monitored and evaluated. So we'll develop a monitoring and evaluation plan. As part of that plan, there will be a baseline pre-training survey on the trainees, on their traditional means of communicating, the value of vaccine, and then the immunization coverage in their area of influence. Then also a needs assessment to say, okay, if this is really a need in their area, right? Then on the training day, there will be a pre and post test to assess the understanding of the content of the training. And then finally, there will be also a follow-up training survey of participants to understand if, conducted 6 months after, to find out if the national coverage in their area has increased, and if they actually are practicing this new way. Because then if you're not practicing it and you see increase, you cannot attribute that increase to this new way of communication. So we expect that after this training, when we do the monitoring and evaluation, we're going to see that these advocates have adopted this new way of communicating, and that has led to improved vaccine uptake and then immunization coverage in their area of influence. So in conclusion, efforts to increase vaccine uptake must incorporate our understanding of the cognitive processes that help drive decision. And these cognitive processes does not just, if you look at the dark green and Whitehead model, you have to consider the other factors, the social setting, the educational needs, the economic needs, the cultural needs, the cultural context, the lifestyle. You need to consider all that so that you are communicating in a way that resonates better with the population. Which board and last century suggested that grassroots communication strategies are more likely to succeed if they are integrated with the provision of some other community health and social needs. So if we are integrating them, making sure you're talking about other of their health as mentioned earlier, there is likelihood of more that the communication will be more effective. And there are also evidence that once we incorporate the socio-ecological factors in messaging and choose the right settings, that is going to lead to increased vaccine uptake, as we've seen in the earlier part of the presentation. And as we saw in the Betty's model, we are not going to use the top-bottom approach. We are going to use the bottom-up negotiated approach, where there will be a personal counseling. You talk to them in a manner that they understand, and then you also engage the community. You bring a community development aspect of it, so where you're engaging the community in the way that they understand, in a manner that resonates well to them. So we believe that negotiated bottom-up model will lead to the community members being more empowered. So having pitched this initiative and shown the evidence that it will work, the approach that we'll use, and how we expect the monitoring evaluation to lead to increased uptake and vaccination. The next step, once this initiative is accepted, is the planning and scaling of this training, the pre-training baseline survey, then the participant, the training is assessment. We have developed the training curriculum, we have to pre-test it, and then we have to carry out this training, which is the initiative we planned, and then the follow-up post-training survey. So those are the next steps, and thank you for listening. These are the reference materials. As I mentioned earlier on, if you find this slide very fast, you can at any point pause and then be able to look through this reference material. So today we've gone through how to pitch a public health initiative. In this case, we are pitching that we want to train national level vaccine advocates on communicating the value or importance of vaccines in a new way. So thank you for listening. I look forward to receiving your questions and your comments and feedback on this training. Thank you.